The first step to dealing with prediabetes is understanding what it means to be diagnosed with prediabetes. Treatment may include lifestyle changes, such as diet, exercise, and medications. If you receive a diagnosis of prediabetes, it means that your blood sugar level is higher than normal. But it is not high enough to qualify for a diagnosis of diabetes. According to a 2014 review, long-term data suggests that lifestyle changes may reduce the risk of prediabetes progressing to diabetes for up to 10 years. A previous study showed that 5% to 10% of people with prediabetes develop diabetes each year. Prediabetes can also lead to other health conditions, including heart disease and stroke. But in this video, you will learn about the symptoms of prediabetes, the treatment of prediabetes, and more, so follow the video until the end. What are the symptoms of prediabetes? Prediabetes has no obvious symptoms. Some people may have a condition called acanthosis nigricans, which is a sign of insulin resistance. Dark, thick, and often velvety spots appear trusted source. It can be associated with the polycystic ovarian syndrome. This color usually occurs around elbows, knees, neck, armpits, joints. If you have received a diagnosis of prediabetes, it is important to speak with a doctor if you experience increased thirst, increased urination, especially at night, exhaustion, blurry vision, sores or wounds that do not heal. These are typical symptoms of type 2 diabetes and may indicate that your prediabetes has developed into type 2 diabetes. Your doctor can order a series of tests to confirm this. What are the causes of prediabetes? The pancreas secretes a hormone called insulin when you eat so that the sugar in the blood transfers to the cells of the body and serves as a source of energy. This is how insulin helps lower the blood sugar level. The causes of prediabetes are similar to the causes of diabetes, although it is still at an early stage. It mainly consists of insulin resistance. Insulin resistance occurs when your cells do not respond properly to insulin. Increased metabolic disorders. Increased metabolic disorders result from exacerbation of hyperglycemia, high blood sugar, and insulin resistance. If you have prediabetes, your blood glucose levels will rise to 100 to 125 milligrams per deciliter. Once your blood glucose level exceeds 125 milligrams per deciliter, you will be diagnosed with diabetes. Risk factors for diabetes. Prediabetes can occur in anyone, but there are certain factors that can increase the chances of developing this condition. Research indicates that prediabetes is closely related to lifestyle factors and genetics. The following are some of the main risk factors for prediabetes. Age. People over the age of 45 are more likely to develop prediabetes. Body weight. If your body mass index (BMI) is over 25, your doctor may want to check for prediabetes. Diet. Regular consumption of red meat, processed meat, and sugar-sweetened beverages can increase the risk of prediabetes. Lack of physical activity. Not only does regular exercise help you maintain a moderate weight, but it can also reduce your risk of prediabetes. Family history. If you have a close relative with type 2 diabetes, you may be at increased risk of developing prediabetes. Tobacco use. In addition to an increased risk of developing insulin resistance, smoking may also be linked trusted source with increased waist size, which is another risk factor for prediabetes. Medical history. Certain conditions, including sleep apnea, gestational diabetes, PCOS, high blood pressure, and increased levels of cholesterol or triglycerides, may be associated with an increased risk of insulin resistance and prediabetes. How to treat prediabetes. Treating prediabetes can also be thought of as preventing type 2 diabetes. If your doctor gives you a diagnosis of prediabetes, they will recommend certain lifestyle changes. A study called the Diabetes Prevention Program showed an approximate 58% reduction in risk in people who kept up with these changes long term. The most common ways to control prediabetes are Maintain a diet rich in fiber. Exercising regularly. Maintain a moderate weight. Take medication if your doctor prescribes it. Some people with diabetes choose to use complementary and alternative medicine (CM) therapies to manage their condition. Complementary and alternative medicine treatments can include nutritional supplements, meditation, and acupuncture. Always consult a physician before starting any CM therapies, as they may interact with your medications. Complications. If you don't get treatment, prediabetes can progress to type 2 diabetes and other conditions such as heart disease, apoplexy, nerve damage, kidney damage, eye damage, foot damage, as poor blood flow may lead to amputation, skin infections, hearing problem, Alzheimer's disease. The good news is that prediabetes can be reversed with long-term lifestyle changes. Prediabetes is reversible. You can prevent or slow the progression of prediabetes and diabetes by making lifestyle changes, including maintaining a moderate weight. According to one 2017 review, every 2.2 pounds. Losing weight can reduce the risk of type 2 diabetes by 16% for people with impaired glucose tolerance or prediabetes. A heart-healthy lifestyle includes: eat nutrient-rich foods. Be sure to include plenty of whole, nutrient-dense foods in your diet, and limit your intake of highly processed foods and sugar-sweetened beverages. High-fiber foods, such as fruits, vegetables, and whole grains, can be especially beneficial for helping you reach your health goals. Exercising. You can reduce your risk of developing diabetes by staying active regularly. Doing 30 minutes of any activity that raises your heart rate to your target rate, such as walking, is recommended most days of the week. Ways to incorporate physical activity into your daily schedule could include: bike ride to work, walk instead of taking the bus or driving, go to the gym, participate in recreational sports with a team. Getting 30 minutes of exercise a day and losing 5% to 7% of your weight can reduce your risk of developing type 2 diabetes by more than 58%. Trusted source, according to the CDC. If you like the content, like the video, and write to me in the comments, do you have symptoms of prediabetes? Share this video with your family and friends so that they benefit. Our goal is to improve your health.